Which of the following is a possible cause of vaginal bleeding in early pregnancy? A. Trophoblastic disease. B. Spontaneous abortion, miscarriage. C. Cervical ectropion. D. All of these are correct. The answer is D. All of these are correct. All of these could be possible reasons for bleeding in early pregnancy, including physiologic or implantation bleeding. Bleeding may indicate threatened miscarriage or other serious condition, or it may simply be due to the implantation of the embryo into the endometrium. Which of the following terms denotes a menstrual cycle that is irregular, of shorter duration than normal, and of excessive volume or duration? A. Amenorrhea. B. Metrorrhagia. C. Menometrorrhagia. D. Oligomenorrhea. The answer is C. Menometrorrhagia. Menometrorrhagia is a term used to describe a menstrual cycle that is irregular, of shorter duration than normal, and of excessive volume or duration. Amenorrhea is the absence of a menstrual cycle. Metrorrhagia is a term for a menstrual cycle that is of normal flow duration and volume, but which is irregular and has a shorter than normal cycle length. Oligomenorrhea describes a menstrual cycle that is longer than 35 days, often characterized by a prolonged follicular phase. Pregnant individuals with gestational hypertension, proteinuria, and signs of liver or kidney dysfunction should be evaluated for what potentially life-threatening condition? A. Gestational diabetes. B. Placenta previa. C. Ectopic pregnancy. D. Preeclampsia. The answer is D. Preeclampsia. Preeclampsia is a potentially life-threatening disorder that generally includes gestational hypertension, proteinuria, edema, red blood cell dysfunction, and signs of liver or kidney dysfunction. It is more common in weeks 32 to 40 and develops in 2 to 8% of pregnancies worldwide. At what point does preeclampsia develop into eclampsia? A. At the initiation of kidney failure. B. At the progression into seizures. C. When there is evidence of vascular dysregulation. D. When blood pressure exceeds 160/95 mm of mercury. The answer is B. At the progression into seizures. Preeclampsia develops into eclampsia at the onset of seizures. Seizures are tonic-clonic and may appear during pregnancy, during labor, or postpartum. It is relatively rare, affecting only approximately 1.2 to 1.8% of pregnancies. What is the most common time for miscarriages to occur? A. 0 to 12 weeks. B. 12 to 20 weeks. C. 16 to 24 weeks. D. 22 to 28 weeks. The answer is A. 0 to 12 weeks. The most common time for miscarriage to occur is during the first trimester, between 8 and 12 weeks. This may even occur before an individual is aware that they are pregnant. Chromosomal abnormalities are identified in approximately 50% of first trimester miscarriages, while later miscarriages may be more likely in individuals with uterine malformations or cervical incompetence.